Introduction. Aspirin is also known as acetylsalicylic acid, ASA. It is a non-steroidal anti-inflammatory drug, NSAID, with multiple therapeutic effects, including pain relief, analgesic, reduction of inflammation, anti-inflammatory, fever reduction, antipyretic, prevention of blood clots, antiplatelet, widely used for conditions such as headaches, arthritis, fever, muscle pain, and cardiovascular disease prevention, for example, heart attack and stroke. First introduced in 1897 by Bayer, Germany. Recognized as one of the most extensively used drugs globally. Mechanism of action: aspirin works by irreversibly inhibiting cyclooxygenase enzymes, COX-1 and COX-2. This inhibition prevents the production of prostaglandins and thromboxanes, which are chemicals responsible for pain and inflammation, prostaglandins, platelet aggregation, thromboxanes. Aspirin's unique mechanism, low doses, primarily inhibit COX-1 in platelets, reducing clot formation. Higher doses provide anti-inflammatory effects by inhibiting both COX-1 and COX-2. Effects are long-lasting on platelets since platelets cannot regenerate COX enzymes. Side effects. Common side effects: gastrointestinal, GI, stomach pain, nausea, vomiting, risk of stomach ulcers and bleeding. Bleeding disorders. Increased risk of bleeding, especially in people taking anticoagulants. Allergic reactions: skin rash, hives, or swelling. Severe reactions include asthma attacks or anaphylaxis. Tinnitus, ringing in ears. May occur at high doses or with chronic use. Kidney effects. Rarely, can impair kidney function in high doses. Less common side effects. Reyes syndrome. A rare but serious condition in children and teenagers recovering from viral infections like flu or chickenpox. Headache, dizziness, or fatigue. Liver toxicity. Rare. Contraindications. Aspirin should not be used in the following situations: allergies or hypersensitivity, known allergy to aspirin or other NSAIDs, bleeding disorders, hemophilia, thrombocytopenia, or active bleeding, for example, gastric ulcers. Children with viral infections, risk of Reyes syndrome. Pregnancy, especially third trimester, may cause complications like delayed labor or fetal harm. Asthma. Aspirin can trigger asthma attacks in sensitive individuals. Aspirin-induced asthma. Severe kidney or liver impairment. May worsen organ function. Peptic ulcers or GI bleeding history. Aspirin increases the risk of bleeding in these patients. Concomitant anticoagulant therapy. Using blood thinners like warfarin increases bleeding risk. Drug use as monotherapy or in combination and most suitable combination generics. Monotherapy. Aspirin is commonly used as a single-agent therapy for pain relief, for example, headaches, muscle pain, arthritis. Prevention of blood clots and cardiovascular diseases. Combination therapy. Aspirin is often combined with other generics to enhance its therapeutic effects or reduce side effects. Common combinations include clopidogrel, used for dual antiplatelet therapy to prevent heart attack or stroke, dipyridamole, for stroke prevention by improving blood flow and reducing clot risk, paracetamol, acetaminophen, combined for stronger pain relief in conditions like migraines or arthritis, omeprazole or esomeprazole, used to prevent gastrointestinal side effects, especially in long-term aspirin users, atorvastatin, combined in cardiovascular risk management to lower cholesterol and prevent clotting, caffeine, found in over-the-counter combinations to enhance pain relief. Most popular international brands containing this generic and manufacturer name and country: minimum 5, Bayer Aspirin, Bayer AG, Germany. The original and widely recognized aspirin brand. Cardioprin 100, Aspen Pharma, Australia. Low-dose aspirin for cardiovascular protection. Bufferin, Lion Corporation, Japan. Buffered aspirin to reduce stomach irritation. Aspro Clear, Reckitt, United Kingdom. Soluble aspirin formulation for rapid action. Ecotrin, GSK, United States. Enteric-coated aspirin is designed to minimize gastric side effects. Adverse events, including use with a meal, on an empty stomach, or with specific food. Adverse events: gastrointestinal issues, nausea, stomach pain, heartburn, and risk of ulcers or bleeding. Common with prolonged or high-dose usage. Bleeding complications: increased risk of bleeding, especially in patients with pre-existing conditions or taking anticoagulants. Tinnitus, ringing in ears, often associated with high doses or prolonged use. Allergic reactions, rash, asthma exacerbation, or anaphylaxis in sensitive individuals. Reyes syndrome, a rare but serious condition in children using aspirin during viral infections. Use with meal or empty stomach, with food. It is recommended to take aspirin with meals or a glass of water to reduce stomach irritation. Using it alongside milk or antacids can minimize GI discomfort. Empty stomach. It may increase the risk of stomach upset or ulcers. Avoid taking it on an empty stomach unless prescribed by a physician. Specific food interactions. Alcohol increases the risk of stomach bleeding. Avoid alcohol while using aspirin. High vitamin K. Foods. Foods like spinach or kale might slightly counteract the blood-thinning effect of aspirin. Anticoagulants, for example, warfarin, heparin, increases the risk of bleeding. Monitor clotting parameters when co-administered. NSAIDs, for example, ibuprofen, naproxen, can reduce the antiplatelet effects of aspirin when used together. Increases the risk of gastrointestinal bleeding. Antihypertensives, for example, ACE inhibitors, beta blockers. Aspirin can reduce the effectiveness of antihypertensive medications. Diuretics, for example, furosemide, hydrochlorothiazide, may impair kidney function when combined with aspirin. Methotrexate. Aspirin increases methotrexate toxicity due to reduced clearance. Corticosteroids, for example, prednisolone, increase the risk of gastrointestinal ulceration and bleeding. Selective serotonin reuptake inhibitors, SSRIs, increase bleeding risk when taken with aspirin. Alcohol enhances the risk of stomach ulcers and bleeding. Food interactions. Alcohol amplifies the risk of gastrointestinal bleeding. Avoid during aspirin therapy. Vitamin K-rich foods, for example, spinach, kale, can interfere slightly with aspirin's blood-thinning properties. Dairy products, for example, milk, can reduce stomach irritation when taken with aspirin. Caffeine, sometimes combined with aspirin for enhanced pain relief, but excessive intake might increase side effects. Pharmacology. Therapeutic class, non-steroidal anti-inflammatory drug, NSAID, antiplatelet agent. Primary uses, pain relief, inflammation reduction, fever management, and blood clot prevention. Target receptor, enzyme, inhibits cyclooxygenase, COX-1 and COX-2 enzymes, reducing prostaglandin synthesis. Pharmacodynamics. Primary action, aspirin irreversibly inhibits COX-1 and COX-2, leading to analgesic effect, reduces pain, antipyretic effect, lowers fever, anti-inflammatory effect, reduces swelling and inflammation, antiplatelet effect, prevents platelet aggregation and reduces clot formation. Duration of action. Antiplatelet effects persist for the lifetime of platelets, 7-10 days. Pharmacokinetics. Absorption. Rapidly absorbed in the stomach and upper small intestine. Peak plasma concentration reached within 1-2 hours. Distribution. Widely distributed throughout body fluids. Binds to plasma proteins, approximately 80-90%. Metabolism. Metabolized primarily in the liver to salicylic acid and other metabolites. Excretion, eliminated via urine, mostly as metabolites, some unchanged drug, tilde, 10%. Half-life, dose-dependent, low doses, 2-3 hours, high doses, 15+ hours, due to saturation of liver enzymes. Bioavailability, oral bioavailability, tilde, 50-70%, depending on the formulation and dosage. Maximum daily dose, general dose. For most conditions, 4 grams, 4,000 milligrams per day. For long-term cardiovascular use, typically 81 milligrams daily, low-dose aspirin. Note, higher doses, for example, 8 grams day, are used for severe pain or inflammation, but must be monitored closely to avoid toxicity. Chemistry. Chemical formula, C9H8O4, molar mass, 180.16 G per mole, half-life. Varies depending on dosage. Low doses, approximately 2-3 hours. High doses can extend to 15+ hours due to saturation. Melting point, 135 degrees. Solubility, poorly soluble in water, soluble in alcohol, ether, and chloroform. Organic molecule class, carboxylic acid derivative, aromatic compound. Bioavailability, 50 to 70% when taken orally, depending on formulation. References McTavish J. Fall 1987. What's in a Name? Aspirin and the American Medical Association. Bulletin of the History of Medicine. Findings. Discusses the history and naming convention of aspirin. JSTOR 44442097. PMID 3311247. Aspirin use during pregnancy. April 2018. Source. Drugs.com. Findings. Discusses the risks and guidelines of using aspirin during pregnancy. OTC Medicine Monograph. Aspirin tablets for oral use. June 2022. Source. Therapeutic Goods Administration, TGA. Findings. Provides dosage guidelines and regulatory information for aspirin. Poison Standard, October 2022. Source. Australian Government Federal Register of Legislation. Findings. Information on legal status, recommended use, and toxicity. Aspirin product information, October 2009. Source. Health Canada. Findings. Official monograph for aspirin use, dosing recommendations and side effects.